In this video, I'm going to be talking about natural alternatives to antidepressants that are clinically proven to have pretty much the same effect, but are considerably safer. So let's get started. Firstly, what are antidepressants? Basically, in a nutshell, antidepressants, that's going to be drugs like sertraline or paroxetine. These are used for treating, firstly, depression. But given the way that they work, they also help certain other conditions like anxiety, premenstrual syndrome, as well as a more severe form of premenstrual syndrome known as PMDD, that's premenstrual dysphoria disorder. It's also used for treating OCD and many other conditions as well. Now, these drugs are known as selective serotonin reuptake inhibitors, which means they basically prevent serotonin, which is a neurotransmitter, a chemical messenger in the brain, from being reabsorbed. And so this results in more serotonin in circulation. Now, serotonin is basically a neurotransmitter that makes you feel, it improves your mood, basically. And so what these drugs do is they basically help to control the neurochemistry with this serotonin in a way that is beneficial to patients with these conditions that I mentioned. Now, unfortunately, while these drugs are certainly very effective, they do have a long list of really pretty concerning side effects. So just to give you a short list of some of the side effects, it's going to be things like erectile dysfunction, ejaculatory problems, decreased libido. It really affects a person's sexual function, and it can cause sexual dysfunction in many individuals. In fact, there's a condition known as antidepressant-induced sexual dysfunction. And so it causes other things like delayed or inability to ejaculate, genital disorders. It can also cause personality changes, lack of emotion, vaginal discharge, menstrual changes, painful intercourse, vaginal itching, acid reflux, all kinds of gastric symptoms as well, like gas, belching, and then it can even affect the way your coordination. It can affect your coordination in such a way that you'll have poor coordination. You'll also have, in some cases, unusual body movements and face movements. They can even be chest pain, and it can actually affect your heartbeat and cause an irregular heartbeat. Now, I would strongly recommend looking at reputable sources like drugs.com or WebMD and checking out the long lists of side effects associated with these medications because they are concerning and you should be aware of them. It's really important for you to know what you're putting into your body and not just trust anything blindly. It's very important to educate yourself and know what you're using. So what is the alternative to antidepressants, and is it clinically proven? Does it work? The most simple solution to this is a medicinal herb known as St. John's Wort. Now, again, in a nutshell, St. John's Wort is basically a medicinal herb with multiple medicinal uses. Now, it has specifically gotten attention for its potent antidepressant effects. In fact, in multiple clinical trials, St. John's Wort was found to significantly reduce the symptoms of mild to moderate depression with a potency similar to that of standard antidepressants. Now, St. John's Wort is generally safe to use. However, it does occasionally present with certain side effects. And some of these side effects are, of course, going to be considerably less drastic, but it still can be like gastric discomfort. Some people will even have a little bit of vomiting and feel a bit nauseous. There can be some issues with anxiety or panic attacks or agitation, short-term memory issues as well. However, the side effects tend to be much less. They tend to occur much less in patients using St. John's Wort in comparison to those taking antidepressants like Prozac. So while these side effects do appear to be significantly less than pharmaceutical antidepressants, I still recommend you use this with proper medical supervision. The thing about natural medicines and what we call supplements here in the United States is that while they're not regulated and they appear to be less effective than pharmaceutical drugs, that's actually quite false. Some of these supplements and medicinal herbs actually have the same effect, if not similar, to pharmaceutical drugs, and they can also be dangerous if misused. So please have the proper supervision when using this. Now, there's another issue that sometimes occurs with St. John's Wort in that it can interact with pharmaceutical drugs, and it can even reduce the effects of certain medications. So use it with caution and make sure the person you are getting your guidance from has properly analyzed your case. in your health and recommended this. Don't just take things blindly because you heard about it on the internet. And be safe. Always be safe. Remember, you want to speak to a healthcare provider, not the person at the cash register at the health food store. Not the people in the comments on online stores. Get it from a person who specializes in this type of medicine. Anyways, that's my take on antidepressants. I hope this information has helped you. If you'd like to get in touch with me, you can do so through my website, drnishal.com. I do online video call consultations, so no matter where you are in the world, you can get in touch with me and I can help you. I'll see you in the next video.